Hi, everybody. This is going to be one of our practitioner spotlights, and I am really excited to introduce you to a friend of mine. We've known each other for quite a while now. We drift in and out of each other's circles often. This is Nicole Karras, and she is a Mayan abdominal practitioner, and she focuses on fertility and reproductive health. And so we're going to talk about what it is that she does. Thank you so much for coming on, Nicole.
Thank you for having me.
You just got you were in the dark and the biggest bloom of sunshine just came through your window. It's really pretty.
Yay!
Right as we started. So I kind of threw in some questions here. I know that you and I'll kind of just meander and talk, but
Sure.
I thought we'd start off with, how did you get started with this type of therapy?
So I'm going to make a long story short. I had finished massage school in Santa Fe, New Mexico, and I was blessed to go to Belize. I was staying in the island, and I had been researching rainforest remedies and had been just looking at different therapies for reproductive health and wellness. And I heard about Rosita Arvigo. So it was within months that I went to San Ignacio and was able to meet Rosita and start learning more about the work, the plants, the medicines, and many other healers there. So then I ended up actually moving to Central America and getting to do hands-on work with Rosita and Hortense and Beatrice Waite.
Oh,
So
that's so cool. I was just thinking as you were talking, I have her book, and now I'm wondering where in the
is it
world.
Sastoon, My Apprenticeship with a
Yes.
Mayan Healer? Such a great book.
Yes.
And it was that through reading that book when I was in Belize, I grabbed it. And then I was like, oh, this is so amazing.
Reading the book, I feel like it should be in my women's reproductive section, and it's not. Um, I didn't think to grab it before we started talking, but I will definitely have to share that with the folks that are watching this. I'll get it out at a live or something.
So yeah, it's one of
So
those
good.
You can pick up anytime, and it really does give Rosita's history and when she came to Belize and how she met Donna Leo Ponte and just her whole apprenticeship, with how sacred it was that she was able to learn from him and then also add her own knowledge
Right.
together to provide this treatment.
Because she is Rosita still with us?
Yeah.
Okay.
40 years into doing this.
I had thought I'd seen her at a conference in the past 10 years, but she's getting up there, so you just never know when those folks leave the planet.
Yeah.
Rosita was a DO, is that right? Is that her medical background?
Yes, and she was a naturopathic doctor.
Okay.
Naturopath, right? So she tendons, ligaments, connective tissue, muscle. So a more gentler version of the chiropractic. So this work was so in her, it was just like a divine alignment with her understanding of the uterus and the ligaments. She just really explored that. And
Rosita, sitting and listening to her talk about, she doesn't suffer fools lightly. I love her personality. But just sort of the things that she was sharing that traditional cultures all around the world know how to care for women. Yeah. And we are so sorely lacking in that information here in the Western culture. Things, her talking about not picking up heavy things during your cycle, and we're supposed to be tough and equal, and we lose so many health care options when we don't understand the woman's body. I love sitting and listening to her. So what an amazing thing to get to study with her.
Yes.
So we are talking, Mayan abdominal practice is there are several different ways to get at this sort of treatment.
Mhm.
There's the Arvigo method, which is Arvigo, and that's through Rosita. And then there is Mercier.
Mhm.
You have actually studied with both of them, but preference the Arvigo method. Can you give us an overview about what the difference is there, what the purposes are?
Sure. And then also Rosita is now the Abdominal Therapy Collective. So there is an Arvigo Institute that still exists, but Rosita is Abdominal Therapy Collective. So you can find practitioners, and that's yeah. So looking up Rosita is with Abdominal Therapy Collective, but both Mercier and Mayan, it's looking at positioning of where the womb is located, and it's an external manipulation. I feel Mercier is a little bit deeper, working on more scar tissue if there's been any surgical procedures. However, we definitely always, touch that and feel that fascia and tissue, no matter what the therapy is. So the work is helping to reposition the reproductive organs, and also help, with the digestive organs if there is congestion, restriction. So we're improving the blood flow no matter what, because I feel both look at the homeostasis and hemodynamic of these systems, that the body is always trying to find balance, and
Yep.
that the blood flow to all of these organs is so restricted. And we know when there's lack of blood flow, then there's, going to be suffering of some sort with these organs. So Mayan, we check to see where is the womb? Is she in optimal positioning? Because we can get, she can get too far forward, she can drop down, she can prolapse, she can get to the right, she can get to the left, she can go backwards. And so we're just trying to help bring back the energy and the 5 flows of the lymphatic flow, the nervous, energy, the fascia, the arterial and venous blood flow, and make sure that we have everything moving. So that's the focus. And it's really like a woman could come one time, or she could come as many times as she needs, dependent on why she's there for the treatment. Or if she's just there, I think every woman, we need to get these treatments. And the biggest thing I love about it is you're taught the self-care, right? So you can do this work. You're not going, someone is always working on you. You can say, I want to do this body work on me. The only time you wouldn't do the uterine part is if you were on an active cycle. You could still continue with the upper abdominal and diaphragm work. And then, so again, with Mercier, she, because Jennifer worked as a fertility clinician, and like I said, more with pelvic surgeries, infertility, she has a certain protocol. So 6 1-hour sessions. There's definitely a back and forth of you talking with your therapist, and there's more reproductive endocrinology involved, with lab work, and about if you need to balance hormones, things of that nature. She does have the Shared Journey Fertility program, and I think she did put out a movie. She's got a great book called Conceive. So much great knowledge. I love Jennifer's work. However, I am definitely with the Mayan Abdominal, the spirit of the plants that we bring in, the herbal, the vaginal steaming, the castor packs, and the work. And I like that there's, it's just pretty organic with where you are, as far as if you couldn't commit to having a series of sessions. Now, I feel
Right.
it is like with the, infertility, Mayan is so amazing too, right? First and foremost, where is the womb in you? If she's too low, your pH changes, there's so much that you can't, hold on to a pregnancy. So again, really just looking into both and seeing what feels best. But I always say starting with a Mayan is perfect, because you gain so much knowledge and access of your reproductive system.
What I've experienced is the Mayan, and I think I the knowledge of all of these alternative options, we call them alternative, and then around the world they're just common they're just common sense. But I came across an article in a magazine about Mayan probably nearly 20 years ago,
Right?
and I'd never heard of any of this. And I still see this, which I think is such a shame, when I teach this course and I get to the reproductive section and I talk about, you don't, if somebody says to you, if a gynecologist says, oh, your uterus is tipped, 9 times out of 10, the woman's like, oh, is that normal? And the practitioner is always says, oh yeah, it's totally common. Well, it may be common, but that's not normal.
Mhm.
We actually, we have an optimal we have optimal health that we can achieve, that we just kind of don't go for, because we don't know that there are practitioners like you that can help us get the right blood flow, put our uterus where it's supposed to be, make sure that everything is working in the abdomen, and what a difference in health it can create. I mean, it's huge.
Absolutely. And like the sacrum too, like, like with looking at the womb and the suspensory, the suspensory ligaments holding her up, 14 different ligaments. And, say the uterosacral ligament is shortened. And so that attaches to the uterus, the sacrum is going to pull the womb out. So there's all kinds of difference. It's either overstretched or maybe contracted ligaments. So there's always hope. And like, a lot of times, with this work, it's good for men too. Any sacral falls, you hit, or, a lot of time gymnasts or horseback riding, roller skating, things that can happen in our youth, that when we really have that shock to the sacrum or the hit, the womb can get out of balance, the sacrum can get out of balance. So that nerve supply that's coming from the sacrum, things get off. So again, it's really about restoring that balance in that whole pelvic bowl. And yeah, the beautiful thing is these ligaments, can get back to optimal positioning.
Yeah.
And I think that a
Yeah.
lot of that's overlooked.
Yeah. Well,
And
women
so-
accept that they've got lower back pain, or they've got pain shooting down their leg, and they don't realize that it can be the pulling on those ligaments of a
Absolutely.
misaligned uterus.
And
When the
also the
first time,
prolapses, right? With childbirth.
yes,
And like
yeah,
maybe your first baby and your pushing was a little bit more, than other women, or you just feel off. And it's like, we begin the work, like 6 weeks, 5, 6 weeks, some, depending on where you are, right away, with getting the faja on, which is basically a band of fabric that you can, once you do the work, you put the faja on and tie it into place. So it's almost like an extra lift and holding, so that, she can get that lifting again. So just stuff that we forget about, right? Because
the really horrible thing, and we're seeing this all over in women's care. But I have a friend right now that was told that she's got a uterine prolapse after childbirth, and they just told her, oh gosh, that's just the way it's going to be the rest of your life.
Mm-mm.
And I told her, no, no, you don't have to just accept that. There's so many things that we're accepting as, your lot in life now, because nothing can be done, and there's a lot that can be done.
Absolutely. There's so much. And I feel, Dawn, me and you together could talk so much, because, with the reproductive health, I do feel that our power has been taken. I look of the
Absolutely.
high heart and the womb being the low heart. And so there's so much in our creative energy center, but there's so much that we can do for all different kinds of gynecological issues. Like, I've done Lisa Kelly at the Red Tent. I've taken all of her pelvic hydrotherapy classes. She has hydrosols, which are the same pH as the vagina, which wants to be acidic. She works, with BV, HPV, I mean, you just think of that Bartholin gland cysts, just fibroids, endometritis, PCOS, but there's like different therapies. And if it's not steams, there's other modalities that you can actually be working on yourself too. And it's not like
never have to be powerless.
Right. And that's I feel like we've somewhat taken, if you put a place of fear into people, that's it's not good. I like that feeling in control. And again, that's the one thing about the cervix, the cervix is the center of the nervous system. The cervix is the end of the vagal nerve. So this work also stimulates the vagus nerve. And there's so much, it's so powerful. There's just so much work, but I think it's, again, accessing these places that we sometimes have armor over and we tend to not go there. And, or if it's a different treatment, like the steaming, just learning a little bit more. And it might be for you, it might not be for you, but these treatments have been from the beginning of time. And that's the thing that's, it's just it's wild. When I look back, there's a book called The Tortola, and it shows women basically dry steaming, or smoking, they're over these big fires, or they would always put the mama up to get the steam. It's something that has just been practiced in these indigenous cultures all around the world. Right. And it's all for the reproductive health.
And we've lost that. It seems that in Western culture, which is ruled by Western medicine and that all of that entails, we want to tell the woman that because her organs aren't out and seen, that they're just a big mystery. You can't know anything and you can't do anything. You're just whatever's happening in there. But I'm really good at laparoscopic surgery, so I can just cut all that out of there for you in like an afternoon, and you don't need it. Right. That's the treatment, which makes me crazy. I've seen so many people, I'm sure you see too, so many women coming in and just, they're 20 something years old. I just had my uterus taken out. It's just they just said it was a really good idea. And, I didn't need my ovaries either, or I said I wanted to keep one. And it's just this, it's so I clipped my fingernails this morning. It's so offhanded of taking out organs that they don't just make babies.
Right.
That's not the only purpose.
Well,
there is so much more going on.
Right. And when we take an organ out, bless the women that have had the hysterectomies, I feel like we all choose, and that is our choice. Yep. However, the spirit of the womb is always there. This work is continual, because what the body will do is things start with gravity to come down, right? So if your womb is gone, everything else kind of starts to sink into that spot. So it's always good to continue with this work, right? So we don't have
that's amazing
restriction and congestion, because the bladder starts to go down. It's the law of gravity, right? So again, it's that lifting, bringing in the new blood flow, making sure the lymphatic, everything on that inguinal area is moving, because with today's culture, there is so much sitting. I feel there's a lot more up and down with the desks and people making sure they're stretching, but it's such a lymphatic cutoff. For sure. And so you see that a lot more. I see it in the sacrum, puffier sacrums, yellower sacrums, acidity when women have really bad periods or cycles. If she is retroverted, then their low back aches, and that's just the tissue becomes acidic, right? And so you have more of that pain. So castor oil packs over the sacrum, dry skin brushing, little things that are not overwhelming to be part of our self-care routine, but that we can pull on when we are, maybe having things happen and we're like, oh, it's just because the body needs more movement. Right?
Yeah.
And
That's
So
amazing that you can work with women who have, I mean, because obviously, regardless of whether or not you were fully informed or whether it was fully your choice, and sometimes it's not a choice because it's a life-saving situation, but when we lose organs, to know that there are still ways you can still work with somebody in that situation for
absolutely.
optimal health, because the body works around what we do.
Yes. And I mean, this is kind of an offshoot, and I was hoping to take Tammy Lee Kent's class, but things came up. I don't know if you've heard of her. She's another amazing, she wrote a book called The Wild Feminine, and I think you would love it. She worked, she learned from Rosita. She got to see Ponte's village, and yeah, she calls Rosita her teacher, but she wrote this book, and she is so like, her work around the ovaries and the energies of the masculine and the feminine, and how we can fire up our creative energies. Like it has like been so, it's just like, it's amazing. It's really, really diving deep into the uterus and the womb and the patterns and trauma, if it's ancestral or just, in our, just
Wow.
the way as when women birth, we're not in community as we were, and there's so much
Yeah.
more aloneness and in the postpartum. And that's another part of the work with the Mayan, is it's from just like preconception, just like preparing to have a baby, and then throughout your pregnancy, and then through into postpartum, so that you have the support and the care. And again, we're bringing her back up into optimal positioning, because those ligaments, it takes a long time. And I think the round ligament, which so many women have this pain, and it's scary because it can create cramping. She goes from 6 inches to, I think Rosita said, like 18 in those last weeks. So that's like,
Wow.
months of healing. Right. And I think we're so fast of like having babies and going, like it's so important.
Back in your pre-pregnancy genes and just keep
Right.
going. You've already had the baby. There's nothing else going on. I
Right.
call it the 4th trimester.
Yeah. Like, and I'm getting more and more into the postpartum care, and just how important it is. Cause those, when you do have babies, that's kind of like what your menopause is going to be like, is how we take care of our wombs,
Yeah.
through the recovery and, or just in general. And that's why, yeah, when you said don't carry heavy things, like especially on your period, when the uterus goes from 4 ounces to 8 ounces, that's a big difference. And where she's located, like if she's lower, you don't want to be lifting heavy objects. And, it's like, it is a time for rest. And we just have lost a lot of that connection of listening to, our own bodies. But yeah, so.
Are you able to help women in menopause?
I believe we help. Yes, all the time. Like, I think it's again, like our ovaries are always putting out the little estrogen, progesterone. That's why
Yep.
steaming, like maybe the steaming changes, and maybe new moon you do for 3 days, but you just keep that hypothalamic loop. It is always there, right?
We're still cycling.
You're still
even though we're
cycling.
not
Yes.
bleeding.
Yes, absolutely. We are still in tune, and there's just a shift, and that's why this work is so beneficial. And looking more into the rainforest remedies, that's the one thing with Rosita. She has rainforest remedies. So female tonic, she's got a bunch of different bitters, and Billy Webb bark, like all these different things that are so supportive. And again, it's all coming from Belize, where I hear the soil has the most calcium, and it's still so rich and nutrient rich. But I know that those herbs, just their spiritual component with the faith and the prayers and the energies, are very beneficial. And that's, the other part of Rosita's work is the spiritual healing.
Yeah, well,
so
there's a lot of that needed. My favorite thing that Rosita ever said was, she said women shouldn't run. She hates that's such a common thing. And I thought, wow, I don't like to run. And now I have full license to never get into running.
No running. But
No
I think
running.
more so, it's especially where the running is taking place is on
Yeah.
hard surface, and it's just like a shock. It's like if the uterus is already
Pounding.
low, I'm
Yeah.
always like, when I take the initial uterine assessment, I'm like, do you run? And they're like, yes. I'm like, can you hold off for a little bit? Let's get her back up. Because
Yeah.
normally, again, you'll have more of, the yeast infection, UTIs. There's just different things that come about when she gets low. And again, that pH is off. But yeah, really fast, just to say, like, in a first session.
Yes, that's where I was going next. So you're right there.
So there's a intake form that I say you can either, fill out what feels good, and then we're just going to talk about, why you're there, maybe if there's anything going on in the moment that, needs addressed. And then the first session's about 90 minutes. We do the Mayan, so all of the abdominal, uterine, and sacral work. And then I teach the self-care. So we go over that fully, and then I will send PDFs of every single thing we've gone over. So not only visually seeing it, because I have to see that, you'll be able to see it, feel it, and then also have it so that you can, take home, the self-care. We'll go over the steaming, the castor packs. I also really love the mugwort packs. It's another amazing treatment that just pulls the damp heat. I don't know if you work with mugwort.
No.
I love mugwort. And so, yeah, it's about 90 minutes, give or take. And then we go with, if you need follow-up sessions, or if that felt good, I just like women to make that choice and see where they're at after receiving a session.
So what are you massaging as you're going through a session? What is actually being manipulated?
So from the abdominal, so we start at the xiphoid process and go to the belly button, right? So there's a lot with everything coming through. And I always say the uterus is the last to be fed and the first to be robbed. So blood flow is so important. If there's restrictions, especially from diet or cold, cold constricts, I really feel that when we get into working under the diaphragm, the descending thoracic, the vena cava, esophagus, all going. So we're kind of feeling down the whole Ren channel, and it's a massage, and that's the self-care too. You're taught that. So then it's like also accessing stomach, spleen, going under the diaphragm, releasing the diaphragm. And then from the pubic bone up, there's a uterine finding. Like, I'll drop off the pubic bone. Again, everything is external. It, it should not feel uncomfortable. Sometimes the womb can adhere to scar tissue, so there can be a little bit of fascial pulling, or you might feel cramping after she is let go. But again, you're working from the pubic bone up, and then from the pubic bone to the ilium, kind of dropping down on either side where the colon would be, where the ileocecal valve would be, and bringing everything to the center. Then there's a lot more with the intestinal, just working, just kind of letting the tissue unwind. If anyone's dealing with constipation or IBS, you name it. If there's different abdominal things, we're accessing everything in that moment of just feeling into the belly. I do incorporate some inner navel work, because all the fascia in the body, you can work the whole body just from the navel, how it all goes out and connects. And then, lymphatic work. So we're saying what's going on in that inguinal area. Is it congested? And I do a little bit of manual lymphatic work, and then an overall, just kind of let the vacuum of the lymph, because it's so superficial, do the work. And then we'll be turning over. I check again what the color of the sacrum is. Can the sacrum move, or has it been hurt? Does it go more to one way or the other, or is it fixed? And then checking in the hips. What's going on? Is there a rotation or high hip, low hip, and kind of settling everything. And then looking if there's scar tissue on that sacrum. So that's basically the session, give or take, adding, more or less if somebody needs a little more, and there's again more lymphatic movement. But overall it should feel like just invigorating, like your blood is moving, things are moving, getting that
Digestion would be
yes.
moving. Yeah.
Yes. So again, the systems of flow and the body is self-regulating and self-healing. So sometimes opening those channels, whether that is, you might feel emotional outlets, right? And getting into this work if there's trauma, if there's a history of trauma or things, to access again, because we're saying high heart, low heart, there's a lot that's held in that womb. So, and it's just to witness and connect, and then allowing again the client, the person to do the work, right? So to do the massage, to feel the movement and balance. So
sounds like, as you were talking about going down through the diaphragm, it sounds like you could even help with like a hiatal hernia where the diaphragm is acting inappropriately around that esophagus. It could be really helpful.
absolutely. And that's like in more of the advanced classes in our Vigo. We just did our advanced 3 training in November. There was more with hiatal hernia, more getting under gallbladder, liver, and really helping milk those organs, and also getting up under and just allowing a little bit of a stretch, So yes, I believe it's just all in all very healing. It's very healing energetically and spiritually, this work. So, and physically,
So
right?
you talk about steaming as well. So a lot of people are familiar with steaming through Gwyneth Paltrow, who made it a superstar thing, but actually she was on the right track there. I've wanted to have a steam out here forever, because
we're gonna have to make that happen.
We need to have it, because now we've got an area that would work these days, now that we're back on the farm. But can you talk a little bit about the therapy of steam and how somebody might learn with you and pick up the right herbs and go home and do something like that?
So like, just to bring it in a nutshell, because I feel like my dear friend Lisa Kelly, Red Tent Wellness in Delray, she has the best vaginal steaming classes and the hydrosol classes, which I feel like we all need to take and know. And so she really gives the whole lineage of hydrotherapy, right? Because we can steam our face, we can steam our vagina, and we can soak our feet. So when we soak our feet, especially with Epsom salts, we're getting 8 liters of blood flow to the pelvis. So if someone's just like, that jump starts steaming the face, because again, the vagus nerve and the the innervation of the cervix, she did a thing at the beginning of COVID where she steamed like every day for 3 weeks, and the stuff she started to pass just through facial steaming was phenomenal, like just old endometrial tissue, dark shedding. So behind the steaming, and you don't have to get caught up so much in the herbs. I really love the energetic of herbs because I love working with certain plants that are really resonating. It can be as easy as one, but let's just say, example, you're trying to bring on a period. I would go more for oregano. I would go for the warming herbs, right?
Okay.
Oregano, let's say oregano, rosemary, basil. And so you're going to bring your water, bring it to a boil, turn it off, steep your herbs while you create the space of your steam. And that could be a bedside potty, that can be a camping potty, that can be your toilet and turning off the water. That could be being in the position of table. You just don't want to burn, your precious, your thighs and or the delicate skin of the vagina, because it's the same. Like this is your cervix, basically your nose. So when you're breathing that water in, if it's too hot, also knowing that. But we would have to do a full setup to feel really good about it, to, share about the steaming. But the whole idea is it's again hitting the Ren channel, like the whole up here. And so that is hitting the perineum, which is rest and digest. And I think so many of us don't land and rest and digest. So even if the steaming is just to bring you totally into like landing back into the body and just receiving the steam, it's really good for, again, if she's maybe off a little bit and hasn't been able to fully shed. It can help. Just thinking of facial steaming, it takes a couple, but it really helps shed the endometrium. So if you're having darker cycles, or more, if there's more of a scent that and that blood is just really dark, that's just been holding on, and it just really helps shed it. It's really great for fertility, right? It warms the womb. In Chinese medicine, women have a cold womb. That's what they work to warm, keep the womb covered. But there's so many different reasons to steam, but I just think overall, like, you're warming that reproductive system. It really can help even into the intestines. I've had women that have Crohn's and IBS and just different intestinal issues that they're like, the steaming just really helps relax my organs and my bowels. I'm like, absolutely.
Yeah.
Okay, put some, but so steaming, again, it's an ancient tradition. And like in Belize, they do this, they start teaching the girls at a very young age. And so it's just another self-care of taking care of the uterus. 1 second. Yeah. And like you said, with Gwyneth Paltrow, and a lot of doctors will say the vagina is self-cleansing, all that. Great. Totally. I am 100% on board. But if you have women that do have certain things going on, and they're just like, it's not clearing, we're not trying to do that. I feel like there's more of an energetic and spiritual,
it's an assistance. It's a loving into the issue, not a stripping away.
Slowing down. And it's like, and then there's more with like vaginal infusions, right? Like you can use, like, who knew that green tea is a yoni food, right? Feeding the lactobacillus, right? We could talk so much.
Oh my gosh. You're like igniting all of this stuff. Like I get focused on other things, and I put this whole realm away for a while, but now I want to dive back in. There's so much. I'm writing down all your books.
So much with the reproductive system, but I say, like, really look up the Red Tent, Lisa Kelly. She's so honest. She's been doing this forever. She sells, the hydrosols, which are organic, and they're so amazing. I've never worked with these hydrosols, but you can just have them in your fridge and spray them, because again, the more alkaline we get, the more prone to bacteria we get. And so sperm is alkaline, water is alkaline, so much is alkaline, and soap, and we strip everything. So these hydrosols bring back the pH. So it can be used like after a bath or a shower, or just in general. And it's like, if you're starting to feel uncomfortable, or, I mean, I love them. For women, especially after, birthing. So many reasons, but there's so much around steaming that I think you could really look into. But hopefully with a person, from the mind's eye of a practitioner that has utilized it, and that believes in it.
Yeah.
So,
well, is there anything else that you would tell somebody about this work, or people that you think are overlooking?
Well, really fast, I'm just going to run down this before I get off. Okay, so here's the signs and symptoms of a displaced uterus, and I'm just reading off because there's so many. But running on cement surfaces, injuries to the sacrum, chronic constipation, poor alignment of the pelvis, carrying young children on the hip for too long, emotional armoring, straining during bowel movements, repeated pregnancies or difficult deliveries, carrying heavy burdens immediately or after, I guess burdens mean just carrying heavy things during menstruation or soon after childbirth. Signs and symptoms. So that would be causes, right? I also think high heel shoes. I also think we could add a lot of stuff that could be causes of a displaced uterus. Signs and symptoms. Displaced or prolapsed uterus bladder, dark blood at the beginning or the end, painful periods or painful ovulation, irregular menses, bladder or yeast infections, miscarriages, difficult pregnancies, endometriosis, endometriitis, perimenopause, menopausal symptoms. If the uterus is displaced, you could have more severe, let's say, or more discomfort. Fertility issues, PMS, ovarian cysts, fibroids, polyps, abdominal or abnormal uterine bleeding, incontinence, infections, varicosities, hemorrhoids, tired, weak legs, numb legs, and feet. So those are just like some to add. And those are, I mean, I feel like we could at least check off one or two of those, each woman. Right. Or many more,
for sure.
Right? So it's just, again, I think it's setting up. And then also when we have our own children, teaching them this work, teaching them this massage, teaching them, as our hormones start to change. And, like if, your daughter does start cramping or has questions, and help us, with all the different products we're putting into our bodies, with what they're sprayed with or where they're coming from, or, just again, like how do we support to keep everything in balance again, right? It's a whole nother divergent that we won't get into, but those are the things that I think the work that I would say it's been a blessing for me. My path that took me on it was having, in childhood, having trauma, and also just feeling so distant from my womb. And then, knowing that I wanted to do some kind of work with the reproductive system, but I didn't know what. And when I found Rosita, and so Donaleo Ponte, really fast, he worked with women, like they came to him for these uteral adjustments external. He knew in their body it was their womb. He called it, like, instead of a prolapse, like a wandering womb. But he always said if a woman's womb was out of balance, she would be emotionally, physically, and spiritually. And so helping her regain her center and lifting up, he saw these amazing, just, women coming out of their, pain and suffering, and like learning the self-care and able to help themselves. So Rosita was like, wow, this little old man who died at 103 in 96 got, notice from the New York Times. I mean, he was amazing, and he brought this work. So, but anything else we can have to be continued if questions come up, and, we want to just sit and talk about other things, because we covered a lot of different areas.
Yeah, there's a lot of things I think for people watching to think about. If somebody wanted to schedule an appointment with you, how would they get to you?
So I am at Inner Wisdom Healing Center, and that's innerwisdomhealingcenter.com. If you wanted to read a little bit more about me, but the best way to schedule with me is to just call me. 614-746-1577, call or text, and we'll get you scheduled.
So 614-746, what was that?
1577.
1577. Okay.
All right.
All right. Well, thank you so much, Nicole. I'm going to stop this recording. Yeah. And
thank you.
We'll let people think about this for a bit.
Okay.